My name is Tabitha Montier. I'm a nursing student at the University of South Alabama, and today I'm going to talk about and demonstrate various injection sites for intramuscular, intradermal, and subcutaneous injections. So the first injection site that I'm going to talk about is located over the deltoid muscle. This is the smallest of the intramuscular injection sites, and it is only acceptable to be used whenever it is a small amount of aqueous solution and injected with a very small needle. So the first thing I'm going to do is to locate my acromion process over the shoulder. I'm going to move my patient's arm up and down to feel it moving below my fingers, and then I'm going to go 3 finger breaths below the acromion process, and then this triangle that is located below my finger is what we are going to use as the injection site. For these injections, we are always careful not to go above the shoulder area or below the deltoid insertion, which is where the deltoid muscle attaches to the humerus, or midway down the upper arm. So this is an intramuscular injection site. So I would make sure that my patient's arm was relaxed, and then I would inject here at a 90-degree angle for intramuscular. The next that I'm going to talk about is the dorsolateral aspect of the upper arm. This is located more towards the back of the upper arm in the lower half. So my landmarks here are the deltoid insertion and the olecranon process, which is the elbow. So I'm going to go 3 finger breaths from the deltoid insertion and 3 finger breaths from the elbow. So I'm left with this small rectangular area. This is a subcutaneous injection site, so I could either inject at a 45 or 90-degree angle here, depending on the amount of subcutaneous tissue present and also the length of my needle. So the next site is the forearm. My landmarks for, this is a intradermal injection site. So this goes just below the dermis. My landmarks for here are the antecubital fossa, which is the interior of the elbow, and the wrist. So I'm going to go 4 finger breaths or a hand's breadth down from the antecubital fossa and 4 finger breaths or a hand's breadth up from the wrist. So this leaves me with this rectangular area here. In this portion of the arm, I'm careful to avoid any veins or tendons that are located in this portion of the arm. So once I've found my rectangular area, I'm going to insert at a 15-degree or less angle just below the dermis with the bevel pointed away from the skin. And upon insertion of the medication, I should see a bleb or bubble under the dermis. So, the next injection site that I'm going to talk about is the abdominal injection site. This is a subcutaneous injection site, and it is preferable for patients that have to have multiple injections for medications such as insulin or heparin. So the first thing I'm going to do is locate a 2-inch border around the umbilicus, and then I'm sure not to go below the pubic area, above the costal margin, or to each side of the anterior superior iliac spine. So that leaves me with a U shape below the umbilicus. And for this site, I can do injections that are a finger's breadth apart. So I can have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 injection sites. So as a nurse, when I'm giving multiple injections to this patient, I'm going to vary my site each time. So this is a subcutaneous injection site. So I would either give the injection at a 45 or 90-degree angle here, depending on the amount of subcutaneous tissue present and also the length of my needle. So you turn towards me. So my next site that I'm going to talk about is the ventrogluteus. This is the best, most preferred site for intramuscular injections. So the first thing I'm going to do is locate the greater trochanter. So I'll do this by moving my patient's leg forward and backward and feeling it move below my fingers. I'm going to place the heel of my hand or on the greater trochanter or the center of my palm if the patient is shorter. I'm going to place my right hand on the patient's left side so that my thumb is pointing towards their groin, umbilicus, or abdominal area. My index finger is going to be placed on the anterior superior iliac spine, and my middle finger is going to spread backwards towards the iliac crest. So I'm left with a V for ventrogluteus. I'm going to always palpate to make sure that I've found good muscle. If I am feeling bone instead of muscle, I would reposition because the locations can be different depending on the patient's size and the hip angle for female versus male patients. So once I've located this area, I'm going to clean with my alcohol swab, and then I would leave my alcohol swab on the patient pointing towards my injection site that I've picked so that I can readjust my hand to get a better angle, and then I would give this injection at a 90-degree angle since it is intramuscular. So the last injection site that I'm going to talk about is the vastus lateralis. It is located on the anterior portion of the thigh. This is the largest injection site that we have for intramuscular, and it can also be used for subcutaneous. So my landmarks for this injection site are, again, the greater trochanter. I will locate it by moving my patient's leg up and down. And then I'm going to go a hand's breadth down from the greater trochanter, and I'm also going to go a hand's breadth up from the knee. I will not go past the midline of the top portion of the leg, and I will also not go past the midline of the side portion of the leg. So I'm left with this very large rectangular area here. I would normally give the injection in the center third of this muscle, but the whole area is able to be used. The center third is more preferable for the intramuscular, and then the subcutaneous could be used throughout this whole area here. And if you were needing multiple injection sites, this would also be another place that you could use. So for subcutaneous, I would either go at a 45 or 90-degree angle, and then for intramuscular, I would insert at a 90-degree angle.